Hello and good morning. Today our topic will be lymph nodes and other organs of the head and neck. And this is the part 2. And so we have moved forward. These are the parotid nodes on the parotid gland. These can be called preauricular and these can be called postauricular as well. And then there are the occipital nodes. And then there are the cervical nodes. Submental below the tongue and submandibular below the mandible. Mandible is going like this, and then there are the supraclavicle nodes above the clavicle. Okay, clinical relevance. They drain the nasopharynx, oral cavity, pharynx, and larynx, and the segmental nodes drain cancer of the larynx, mouth, lip, anterior, and 2/3 of the tongue, gum, and mucosa, and cheek. The supraclavicle nodes drain the thyroid, piriform sinus of the upper esophagus, primarily below the clavicle. Okay, and the cervical lymph nodes drain the nasopharynx, oral cavity, pharynx, and thyroid. Okay, facial muscles. As you can see, this is the Epicurean Aponeurosis, and this is the frontalis on the front. Orbicularis oculi. Orbicularis meaning surrounding the oculi, eyes. Temporalis above the ears. Occipitalis covering the occipital lobe. Masseter is for grinding. Buccinator, which is for moving of the cheeks. Sternocleidomastoid, elevating the clavicles. Zygomaticus major, and the orbicularis oris. Orbicularis meaning surrounding, oris means lips. They are also called labi. Okay, what if how to examine a lump? If there is an anomaly present, meaning infection or something, we can take history. If they have slow fast pain, associated red flags. If they do smoking, hoarseness of voice, weight loss, family history, and the primary cancer of head and neck, then we will see the lump is fixed or mobile. Mobile means moving. Is it discharging anything? Is yellow, red, or black? Position of the gland. Inside mouth. Is it present inside the mouth as well? Okay, is it giving any weakness or palsy? Okay, this is the history, character, etc. If does it move with swallowing? If it does, then it's a cyst. No, dermatitis cyst meaning in the skin or chondroma. If it does, it is related to the thyroid, the cyst of thyroid. Does it move with the protrusion of the tongue? Yes, then it's a thyroglottal cyst. No, then the thyroid is enlarged only. Goiter, it comes from the deficiency of iodine. Thyroid, this is the thyroid cartilage, and this is the trachea, and this is the thyroid. As you can see, it is present on the both sides. It's like a butterfly. Then there is the thyroid swelling. A goiter is the swelling of the neck and larynx resulting from the enlargement of the thyroid gland associated with is functioning properly or not. Its function may be normal, which is the non-toxic goiter, overactive meaning toxic, underactive meaning hypothyroid. Why to operate? If there are lumps in the anterior triangle, then we will do the lymphadenectomy, lymphadenopathy, salivary glands pathology. It can be stone, tumor, or infections. Brachial cyst, laryngeocele, a parotid gland swelling, carotid body tumor, and carotid aneurysms. This is the parotid gland, and this is the accessory duct, and this is the parotid duct. This is the sublingual, this is the submandibular. Okay, Parotid swellings can be unilateral or bilateral, meaning on one side or both sides. Main, they can be due to mumps, parotitis, titis means inflammation, cellectasis, meaning related to eating, and these are some other conditions. It can be due to these systematic diseases and these drugs. The swelling can be due to these, all of these. Lumps in the posterior triangle. It can be due to lymphadenopathy, cervical rip, pharyngeal pouch, cystic hygroma. Okay, and investigating a lump, history, examination, and the blood test, and we can also image by these processes. This is a chest X-ray. Okay, this is then enlarged thyroid gland. Okay, as you can see yourselves. Spot diagnosis. Okay, we don't need to concern ourselves with this. Okay, she has a swollen cheeks, parotid swelling maybe. This is a cyst, thyroidal cyst. Okay, these are the enlarged lymph nodes. Yes, you should be concerned. Okay, post-auricular lymph nodes are swollen, cervical. What operation has been done? I think his thyroid has been removed one side maybe. Okay, he might have some kind of cyst in the segmental nodes maybe. Okay, what does he have? He has maybe segmental nodes or submandibular nodes swollen. His carotid artery is swollen, I guess. No, he is having hepatojugular reflex in here. External jugular vein distension. This is the result of elevated central venous pressure (CVP). In practice, the EGV is not reliable in determining CVP, the internal jugular vein. The external jugular vein. Okay. Central venous pressure. Okay. This is the central venous pressure. What is a brachial cyst? It is congenital failure or obliteration of second brachial cleft in the embryo, anterior border of SCM. Okay, this is the SCM. This is the anterior border as well. This is the brachial cyst, brachial cyst, brachial cyst. He might have, I don't know, you tell. Okay, cystic hygroma, congenital multiloculated lymphatic lesion that can arise anywhere but classically found in the left posterior triangle of the neck. Okay, this might be this cystic hygroma that can be associated with Turner's and Noonan syndrome. Okay, epigastric pain, weight loss, nausea. In the previous 3 months, he had lost 10 kg. He has a hypothyroidism, maybe. Okay. Okay, we don't need to read this. Okay, which nerve? You tell. Left-sided facial weakness. This is the drooping. This is called drooping of the face, and it is due to the Bell's palsy, inflamed cranial nerve 7, hyperacusis, change in taste, facial droop. This is this, and treat with steroids. Eye drops should be given. Okay, this is cellulitis. Okay. Okay, this is diffuse cellulitis, you can see, and this is an orbital abscess. This is the suprareostal abscess, and this is the cavernous sinus thrombosis. Okay, types of headaches: sinus headaches, and pain is usually behind the forehead or cheekbones. These cluster around one eye, tension, squeezing the head. This is tension. Migraine is half head hurts, uh, half head hurts. Okay, including the face. Okay, thyroid cartilage, cricothyroid hemorrhage, cricoid cartilage. These can be emergency airways and can be penetrated in case of any emergency. No. Okay, you should know these. Thank you very much for listening, and I hope you like it. Goodbye.